Hello, I'm Jeff Cummings, Director of the Cleveland Clinic Ruvo Center for Brain Health. At the Center for Brain Health, we take care of patients with Alzheimer's disease, Parkinson's disease, and multiple sclerosis. We conduct research and perform clinical trials to try to find new treatments for patients with these brain diseases. A critical aspect of our care is to work with caregivers. This series of videos introduces you to aspects of caregiving, including how to take care of yourself.
There are changes in the way our brain functions that are a normal part of the aging process. It's helpful to understand what happens to the brain as we age and how it affects our ability to think, remember, and learn.
As you get older, your brain processes information more slowly, and this has a domino effect on other aspects of thinking. You might not be able to come up with the right word exactly when you need it in conversation, and this can be quite frustrating. If you're distracted, you might not remember where you put the keys when you came in. These can be perfectly normal parts of aging and are the result of shrinkage of the brain and an accumulation of tiny unnoticed strokes that some of us may experience as we get older.
So what is not normal? It's important to recognize warning signs and symptoms that signal problems that may interfere with our ability to take care of ourselves and stay independent.
Changes in multiple aspects of your thinking, persistent forgetfulness, getting lost in familiar places, and changes in personality can suggest that something is happening beyond normal aging. Thinking difficulties that lead to us forgetting to pay bills or forgetting to take medication on a frequent basis could be something to be concerned about. It's important to get these checked out. It doesn't necessarily mean you have Alzheimer's. There are plenty of other things that can cause these changes and that can be treated.
Other factors that can affect cognitive aging are lack of sleep, depression, poor diet, medications, vision and hearing problems, pain.
Sometimes things we can change, like diet, sleep, or depression, can cause problems that look like dementia. The good news is that with the right treatment, these problems can be taken care of.
Dementia is a decline in memory, thinking, and reasoning skills. Tests of memory and other brain functions can identify the extent and pattern of decline. Performance is compared with that of normally aging adults to see what is truly abnormal versus normal aging.
One example we often see is that Alzheimer's patients can remember events from their youth while forgetting that they've just had a meal or asked a question. Childhood memories remain relatively preserved with age. In all adults, it's the new information that's most vulnerable to loss with aging. New memories are lost while old memories, made when we were children or young adults, are preserved even into the moderate stages of Alzheimer's.
As we age, it becomes more challenging to learn new information or multitask. Completing a chore may require more concentration and the elimination of distractions, such as a television on in the background. Overall, it may take more time to remember a word or learn something new. This is normal. But if you're worried about yourself or a loved one's memory loss, a visit to the doctor is in order. If someone close to you suggests that they're concerned about your memory, it's important to see a doctor too, since people with memory loss often don't recognize forgetfulness in themselves.
There are ways to sharpen the cognitive process. Reducing stress through exercise and relaxation can be beneficial, as can good sleep habits.
Exercising the brain is as important as physical exercise. Mental stimulation can protect against age-related declines in thinking and the risk of developing Alzheimer's disease. Reading, playing cards or board games, and attending adult education courses can help keep the brain in shape. Regular social interaction is important too. As we age, visits with friends and family are often the best medicine to maintain a positive outlook and a sense of purpose.